And now this is a good time. I love doing this. For the first time from our Dynamic Lifecycle Innovations family interview area, here is Joni Smith.
And live from the interview area, good morning, I'm Joni Smith. We are starting out on an unbelievable note. First of all, 3 days. Thank you in advance for considering with your donations, as we're going to be asking for the next 3 days. Our phone bank, our Gunderson Medical Foundation volunteers, they're already taking phone calls. Let's hear for that phone bank. And up bright and early, Dr. Nicole Hennessy is with us. Good morning, doctor.
Good morning.
So you getting up in the morning is probably a little bit of you have a 15-month-old at home.
I do.
Mr. Jackson.
Mr. Jackson.
Congratulations.
Thanks.
Because I can remember some of these times that we were with you. You were very pregnant last year.
I was.
Yes. Well, we congratulate you and your husband very much.
Thank you.
And thanks for stopping in this morning to tell us, you work in the peds department.
I do.
Could you please explain to us, just because sometimes I'm confused about this, right now the numbers that we have on the board, we have 5 sick babies. There's 4 in the NICU, 1 in the PICU. Could you tell us the difference between the NICU and the PICU here at Gunderson Health System?
I sure can. We actually have 4 separate pediatric units that we have here. So the PICU is the pediatric intensive care unit. So that's the sickest of the sick kids who are not brand new babies. Our NICU is our neonatal intensive care unit. So that's the sickest of the sick brand new babies. So babies who are born prematurely or with different medical complications and can't go home right away with their moms and dads from the hospital. And then we have a pediatric unit, which is our sick kids, but not the critically ill. And then there's the newborn nursery. So we've got kids kind of everywhere doing lots of things.
Over the next 3 days, we're going to be asking people to look inside themselves and reach into their hearts and give to Children's Miracle Network hospitals, Radiothon. And what would be some of the really important things that the money would go for that would help you being a hospitalist? What are some of the items that would be really important?
So for our families, one of the big things is the meal tickets. This is something that's super special to what we do here at Gunderson. When a child is in the hospital with us, one of the things that you never want to do as a parent is have to leave them. And one of the big worries that a lot of families have are, how are we going to eat? I'm not working this week because I'm here with my baby, and now I'm not making money, and I don't want to leave to go down the road to get food. So we give meal tickets out to all the parents so they can zip down quickly to the cafeteria, get lunch, get dinner, and pop right back up. So saves them both money and time, and they're able to stay with their children without having to worry as much.
You're on a very special committee.
I am.
And this committee, I don't know how you guys can make some of these decisions, because it's got to be absolutely heart-wrenching. Tell me about the committee that you're on.
So I sit on the Children's Miracle Network committee, and so when a family needs something, whether that is help financially with travel, all the way up to needing special medical equipment, they can provide applications to the committee, and myself with a large group of other people sit down and read all of those applications and make decisions how we best allocate all the special money that's coming in today to these wonderful families.
Sometimes I feel it's like a little bit of magic, because all of a sudden you're aware of these families. How does that happen?
Our social workers are hugely involved in this process. And then just with being in the hospital, a lot of these children are in the hospital a lot. The Children's Miracle Network team gets to know them well and checks in with them. But I would say most of our referrals come through our social workers.
So here's a phone number that we're going to be repeating time after time, because we want these phones to be ringing. They already have this morning, but we always want more. So it's 608-784-KIDS. So if you look at your phone, it's 5437 is KIDS. That's what it spells out. 608-784-KIDS. And we invite you to place a call this morning. The Blood Center of Wisconsin phone bank is wide open. Gunderson Medical Foundation staff are staffing. You all look so wide awake. Hello, phone bank. Hello. It's so nice to have that support system behind you. And we would like at least 4 calls while we're having some discussion. We already have 4. Well, then let's just go for more.
Yay.
Because we're not going to stop at that.
No.
Maybe we should just like double it.
That sounds
Yeah,
awesome.
We'll go for 8. We'll see we're already at 4. That's really good. So, Dr. Nicole, how long have you been part of the team?
So I've been at Gunderson since 2011. The hospitalist group started then. We transitioned into having a solely hospitalist team at that time, and I came on as the start of it. So
When you have a new baby like you had 15 months ago, you have Jackson, is it hard for you as a mother to get up and leave the house in the morning and get to work?
Having a child has definitely changed my practice and my life. I deal with the same things every mom deals with, getting up in the morning, trying to get everybody ready. But when it's 3 a.m. and I am taking care of a kid, I just often have to reflect back on how thankful I am that it's not my baby. And if it was my baby, that I would want the doctor to be able to step beyond what's going on in their own life, or that they haven't slept in nights either, and just do the best for that kid at the time.
So as moms and grandmas, we know what it's like to go through a morning routine. I can't imagine what it's like if you have a child with special needs. What are some of the complications that you see where you send these babies home with equipment? What are these parents going through?
I think that it's hard enough to sleep at night being afraid of what's going on with your baby and not being able to see them, and then to know at some point in time that your baby literally stopped breathing and still have to sleep through the night. So these babies go home on monitors to make sure that they're breathing appropriately and their oxygen is staying at a high enough level. Babies are on feeding equipment, so they've got tubes going into their bellies to help them eat because they're not able to eat through their mouth. Medicines, I think we all underestimate how much time it really takes to get a child to take medicine. I've got a 4-year-old at home too, and when she's got an ear infection, just doing an antibiotic twice a day for a week, it's like torture to remember to do it and then to convince her to take it. These are families that are doing 6, 7, 8 medicines just in the morning. That doesn't count the other 4 or 5 times they're giving medicine throughout the course of the day.
So that reminds me of a little story, a little family story here. Trying to get our little baby Hayden to take her antibiotic because she had I think it was an ear infection, and she did not care for it.
No.
And she chose to spew it across the room. So what you're trying to do is find out a way that you can literally get your little one. Now, what ended up happening is applesauce is your friend. And getting it into the applesauce. I mean, what you have to do is really, the little things where you puff into their little face and, they open their little mouth and you're supposed to squirt it in. Does that really work?
We've got tons of techniques.
Yeah, I bet you. I'm sure you do.
Our nursing staff is phenomenal in finding what is the right way for each kid, whether it's rewards and stickers after you take it, to chocolate sauce is probably your best friend.
Really?
Because it masks the taste of just about anything. Okay. So pull some chocolate sauce up in the syringe, then the medicine, and then the chocolate sauce. It's the medicine sandwich. Works pretty often.
See, you know what? You are a wealth of knowledge. You're a wealth of knowledge for all of us. I think what we're going to do is give you that number again and make sure you write it down. 608-784-KIDS, KIDS 5437. Now that you have it written down, maybe you'd like to call us. Give us a call here. Make miracles happen. We're waiting on you. The Oral Surgery Clinic of La Crosse, we'd like to thank them so much. And RE/MAX, we have tons of sponsors. We don't do anything without our sponsors around here.
No way.
And isn't it something that year after year after year, it's some of the same sponsors that come back again, and there's a reason for that, because they love to hear about miracles too, and they like to help make them happen.
We've got a pretty impressive community.
We do have an impressive community. So our daily sponsor today is Carey Heating and Air Condition. I passed them on the way in this morning, and they're not up yet, but they will be up soon.
I'm sure they will.
Yep.
Yay,
the phones are ringing, 608-784-KIDS, 5437, and we thank you so much for doing that. And you know what? There is another thing that you can do. Now, this is so on the other end of me because I'm not, a techie person, but it doesn't take much to do. #Bittersweet4Kids. So Bittersweet, what they're going to do every time somebody does that, they donate $1 through this whole entire radiothon. So it's #Bittersweet4Kids, Twitter, Facebook, Instagram. See, isn't that something?
We're
that something?
everywhere.
It's that they're everywhere, and we thank them so much because they're a wonderful sponsor too. So I think what we're going to do is we're going to let you go back home and take care of Jackson. And what's your little girl's name?
Harper.
Okay. So you probably have some mommy things that you need to do.
I do.
But I do appreciate you, explaining to us the importance of hospitalists and obviously the importance of being able to take some of these funds and help out these families, because that's what we're doing.
It's awesome.
Anything else? Any parting words that you would like?
Thank you to everyone. This is how we make it happen.
That is how we make it happen. And on that note, 608-784-KIDS 5437. You're listening to the Children's Miracle Network Radiothon, a service of the La Crosse Media Group.